Welcome in Medical Information Program. Our topic today is chronic cardiac failure. To know something more about this disease, we speak today with Professor Massimo Piepoli, Chief of Department of Cardiology in the University of Milano, Italy. Professor Piepoli, what means chronic cardiac failure and what are the signs of this disease?
Cardiac failure is typically a disease which is characterized by a weak heart. Weak heart means that the heart, like as a muscle, doesn't work very well. It means that the blood cannot circulate very well, and all organ, all part of our body is affected, is suffering because it doesn't receive nutrition, it doesn't receive oxygen, and it feels definitely weak. Consequently, the symptoms, the signs of a patient with a heart failure is typically related to all body. You feel weak because the muscle doesn't receive enough blood. It feels also breathlessness. First on exercise, then even at rest when he's lying in the bed, because his lungs doesn't receive enough blood, and eventually the water is congesting, is remaining in the lower part of the lungs, and consequently, when it is even more developed disease, there is a congesting all over the body. Firstly, in the lower part, it can be in the legs, in the ankles, then the first after that what also in the tummy, in the liver. So this patient is very, very affected all over his situation. It is a very important condition because it affects something like more than 1 to 2 people above 75, over 75 years old. It is the first causes of hospitalization and one of the major causes of death. And this, unfortunately, is a rate of hospitalization and death is increasing.
What are the signs and symptoms of this disease?
Exactly. The first signs, the patient commonly feels unwell, doesn't feel as strong as it was in the past. He feels shortness of breath on exercise. And after that, the most common condition are exactly the presence of water in the lungs, the presence of water in the legs. And it's for this reason, usually the GPs require the assistance and the opinion of a cardiologist.
May only the pharmacological therapy be enough, or sometimes we need mechanical support or other things, other procedures?
This is very important. One of the great success we had in cardiology has been the treatment, the pharmacological treatment of heart failure. Of course, beside the common cardiovascular risk factor, which is hypertension, which is diabetes, which is physical inactivity, or even high cholesterol, we know that there are good therapy that can be able to even reverse the situation and can improve the heart and to maintain patient in a good condition and good quality of life. But sometimes the heart becomes so weak that drugs and pharmaceutical intervention are not enough, and there are some interventions that are needed. First of all, we have to consider the possibility to eliminate the excess water by some intervention, like hemofiltration or ultrafiltration. It's possible in case of, in more advanced case, the possibility to consider the heart transplantation, which is quite uncommon, unfortunately, but there is also a possibility nowadays to put some artificial intervention called the artificial heart that are able to replace the normal heart could be also a bridge to decision, or a bridge to therapy, or even a bridge to transplantation.
Do you have some advices for patients in chronic cardiac failure?
Well, for cardiac, first of all, is the prevention. Prevention before the disease develop, by taking into consideration all the common cardiovascular risk factors, while when the disease is developed, the importance of keep strictly in line with the recommendation of your doctors regarding the importance of pharmacological therapy. Keep an eye on the possibility to have a regular checkup. Could be blood test, could be clinical evaluation, because we know that also in some cases can be the causes of heart failure can be reversible. If there is a valve to be replaced, if it is an arrhythmia to be treated, if it is a muscle to be improved.
Thanks, Professor Piepoli, for having you in our program. For any questions, you can write us in this account. Thank you very much.
Thank you, Pandera.